Hi, everyone, and good morning. My name is Lori Hendren, the Associate State Director of AARP Illinois, and thank you for joining us this morning. And I want to welcome you to a very, very important discussion about the coronavirus vaccine here in the state. AARP is a nonprofit, nonpartisan organization and has been working to promote the health and the well-being of older Americans for more than 60 years. In the face of the virus, we have been having discussions and providing information and resources to help older adults and those caring for them. If you participated in one of our virtual conversations before, you know that throughout the broadcast, we are encouraging you, the listener, put comments in the feed and it will get right to us and we can ask our special guests your questions and comments. So I think we were grateful 2020 is in our rearview mirror, and COVID, of course, is still with us. It probably will be for a few months ahead, I'm hopeful. But the virus has mutated and it continues to see outbreaks nationwide and shows us just how difficult preventable efforts can be. And while vaccines are here and all those over 16 are eligible, distribution has and remains challenging, especially for homebound individuals. And many Americans continue to feel the emotional and the financial hardship from the pandemic and truly fear what is to come. But we're looking ahead today to identify solutions, help elevate the fears, and we will hear from the Illinois Deputy Governor Flores and the Illinois Department on Aging Director Paula Basta and how we can combat COVID together and the latest on vaccine distribution in Illinois. Again, I am Lori Hendren with AARP Illinois, and I want to thank you for joining us. Today, we're going to be hearing from Deputy Governor Flores and the Director on the Illinois Department on Aging, Paula Basta. First, we're fortunate this morning to have with us our two honored guests, and thank you, Deputy Governor Flores, for taking what is very, very hectic time for you and your team. Speak with us. Now, for all of you listening, Deputy Governor oversees the Health and Human Services agencies. So we're looking at Department of Public Health for one, and also Department of Aging, state funding vote of $35 billion and 15,000 plus employees. Under Deputy Governor Flores' leadership, Illinois is proud to continue collaborating with the state of Illinois on education efforts and helping our population get access to the information and resources they need during these challenging times. Deputy Governor Flores, thank you for joining us today.
Thanks for having me, Lori. We are so pleased to be here and so pleased to partner with AARP, and pleased that your guests are joining us and taking the time out of your busy days to ask questions, to gain more knowledge, and to share with your family and friends and local communities about what they can do to protect themselves during this ongoing pandemic.
Thank you so much. And this morning, we also have the director, the Illinois Department on Aging, Paula Basta. Paula is the 13th department director and the 7th woman to lead the agency as a lifelong advocate for care and treatment for senior citizens. She brings just vast institutional knowledge of policy, social justice, and a fiery voice to make sure seniors are taken care of. Director, thank you so much for joining us this morning.
Thank you, Lori, and thanks for this opportunity to join you and all of your viewers. Of course, always grateful to be joined by our Deputy Governor, Flores. I also want to just say how proud I am to partner with AARP Illinois and want to thank you and your staff for all of what you're doing for older adults, especially these past 13 months, although it does seem like it's been a little bit longer. But the work we're doing is very, very important. So excited to talk with you all this morning. Thank you.
Thank you. Thank you very much. So if you're just joining us, we have the Deputy Governor of Illinois, Flores, and the Director of Illinois Department of Aging here for you to answer your questions and comments. So make sure you put them in our social media feed. So the clock is ticking. We have our honored guest till 10:30, and we're going to use our time now. So let's get to our questions. So this is first for the Deputy Governor. The spread of the coronavirus continues to be a top concern at the federal level and as a national response, and state lawmakers are continue and the leader of the governor to take those extra steps to respond. Just recently, we heard about the governor has in your team the Pandemic Health Navigator. For listeners, can you explain what this is? What does this mean for them and their families?
Yes. So the state of Illinois, via support from the federal government, helped to fund pandemic health navigators across the state. Our particular work outside of Chicago and Cook was managed by the Illinois Department of Public Health. And then in Chicago and Cook, those navigator programs were managed directly by the Chicago Department of Public Health and the Cook County Department of Public Health. So outside of Chicago and Cook, the Illinois Department of Public Health funded $60 million to community-based organizations to hire pandemic health navigators to do a few things. First and foremost, to educate individuals about what is COVID-19, what is the pandemic, how do you protect yourself, how do you get tested, what does it mean if I've been exposed, what does that mean? So even though we've been in this for 13 months, there are many people who still need those daily reminders, or many people who don't have the information. It just hasn't reached them in a way that's meaningful or that they can understand. The Pandemic Health Navigator program also does a couple of other key things. It can provide social service assistance for those vulnerable Illinoisans who are exposed to COVID-19 and find the need to isolate, who test positive and are having trouble either getting groceries or getting to a doctor or need help with medicine. The Pandemic Health Navigators can provide those social services. And lastly, just as important, the Pandemic Health Navigators can help educate about the vaccine and help connect Illinoisans to making their vaccine appointments.
Wow, this is huge. I think this is a game changer for the community. So how would one be able to identify? Sounds silly, but for a trusted individual, will we know that, hi, I'm the Pandemic Navigator, or is it community partners? One, how do we identify, and then how do we find them?
Yes. So the state of Illinois partnered with two key organizations here in Illinois, and they in turn have helped to partner with multiple community-based organizations.
Okay.
And so these are nonprofits in local communities that we know are trusted messengers, right? And how important is that? Just like AARP, a trusted messenger. So what would happen is an individual is potentially exposed to someone, and through our contact and tracing efforts, we find you. So let's take, it would be Paula, and this is this, and I would be a Pandemic Health Navigator, and I'd say, Paula, someone has reported that they were with you in the last 48 hours, and they have now tested positive for COVID-19. Do you have symptoms? Have you been tested? Can I help you get to a testing site? And if Paula would respond with any of those affirmatives, the Pandemic Health Navigator can then dig in. So that's one way, is that we will contact individuals directly through contact tracing. The other piece, Lori, is community outreach, right? So they'll just be out there in those communities where they are trusted messengers, working with vulnerable populations, letting them know. Again, most of these community-based organizations are FQHCs, they're federally qualified healthcare centers. So seniors and folks know who they are. They may already go there. They're their medical providers. They're social service agencies. They're the large hospital system. So they're well known in their local communities.
Oh, that is good news. And we look for more information to be able to promote and to connect. Because I think a lot of the responses would be, well, I'm concerned about fraud, but I really appreciate how we're looking to trusted, probably community partners we already have, they've already been talking with, and it's just solidifying that conversation. Thank you, Deputy Governor. So I want to turn to Director Basta. We've been hearing a lot from people. I've got my vaccine. Now what? What do you say to individuals that are ready for some normalcy, but we still got to be reminding that conversation, we're just not there yet?
Yeah. We say, hang in there. Believe me, just hang in there a little bit longer. There are many myths, many rumors out there. We want to make sure that you have what you need to get the vaccine. And so to that end, we have the Aging Network already in place, and making sure that however you need to get vaccinated, we will help you do that. The Aging Network has been incredibly resilient throughout these 13 months, as you know, and we really have only stepped up our game to make sure that we're hearing and with the seniors and the older adults and their families that need to get vaccinated. And however it's possible, we're there to help you. So we've done a couple of different things. Working with the Aging Network, we want to make sure that we're getting you to the services you need. One way is through our area agencies on aging. So all 13 area agencies on aging throughout the state. So no matter where you live, if you're on this call listening today, on Twitter, Facebook, wherever you are listening to us, please know that we can serve you where you live. So I want to just make sure that you'll have our 1-800 number up at the end of this call, because I want them to know that they can just give us a call or look on our website to see who the area agency is. Give them a call, make sure that you tell them where you live, what it is you need, how it is that we can assist, and we'll get you there. So what I can say is hang in there. We have a little bit more of a road to go. We also want to make sure that people continue to get the best education and outreach around the pandemic, around the vaccine, and how it is safe. and how it is still that you can still get the vaccine and where you can get it. So, everybody, I think, is, a little COVID fatigue is set in, but we want to make sure that we know that it's going to be still possible to stay healthy, stay well, stay engaged, and that the network is there for you. I'm going to stop there and see if you have more questions for me about specifics.
We sure do. So while you were talking, I was quick on the type. I put in the Area Agency on Aging and the Senior Helpline.
Yeah.
So all of it will be there on the comment. So we're going to go to talking with Deputy Governor. Let's talk about safe and effective COVID-19 vaccine. We know it's not just critical, it's essential for the component for us to get back on track and combat hospitalization and deaths. So can you give us a status update of where we are at vaccines? And then also let's talk about the J&J vaccine. We had a 13-day pause. It's been lifted. Let's talk about where we are with that too, please.
Yes. So as of last night, our numbers are 24 hours in arrears. We've had 5.5 million Illinoisans receive at least one dose of a vaccine. We've had 79% of seniors, those individuals aged 65 and over in Illinois, receive a vaccine. So we're proud of that work that we've done thus far and have a lot more to go in order to protect Illinoisans. There are 3 vaccines that are available and approved by the FDA for use: Pfizer, Moderna, and Lori, as you just mentioned, J&J. That pause has been lifted with a warning that women from a certain age group should be aware of, and also guidance to those providers around if women in that age group show up with a particular type of blood clotting disorder, how they can report it, how it could be treated, etc. I'm not a clinical provider, so I won't go into the details of what the blood clotting is, but after review of the evidence, the ACIP committee voted, and the guidance was accepted to unpause J&J. So it is now available again for use throughout Illinois, and in some of our partner sites, our MassVax sites, and our mobile teams that we're executing around the state. Consumers will have a choice. They will learn about what vaccine will be available to them on that day and can choose of their own free will what they would like to take. I will tell you that here in Illinois, the J&J vaccine use did receive a lot of positive reviews. There were communities and providers that were very excited to be able to take this dose because it was one and done. And individuals got excellent protection when it comes to severe hospitalization and death. J&J has the same efficacy as does Moderna and Pfizer from that perspective. And providers also found it successful, particularly with vulnerable or hard to reach populations. Those that might be rural, those that are transient, individuals experiencing homelessness, some young folks who perhaps are moving from city to city or state to state because of school or work. So we encourage, your listeners and watchers to go online to CDC, to read about the 3 vaccines, to ask your providers questions so that you can be educated about what you would like to take best for yourself.
That's wonderful. So I want to go to Director Basta. Illinois has launched a toll-free number for vaccine appointment, and it's 1-833-621-1284. Can you talk to viewers? And I know AARP has been a loud advocate for this and has been urging this. What does this mean? Is this kind of a one and I can call and I have to get online and tinkle around? What does it mean?
Yes, the number there that's up on the screen, you can call to make an appointment. Make sure that you get your appointment close to where you're living so that it's convenient for you. If you're having trouble getting there, if you have trouble with accessing transportation, that's where you can call your area agency on aging or your care coordination unit. If in fact you're in our CCP program, we are here to help you. You can always call the 1-800-252-8966 number, which is our Illinois Department on Aging number, to just go ahead and say, I live in Quincy. How do I get to my vaccination appointment? I just made it over the phone so that we can help you. Our aging network is out there to assist and to really break down those barriers. We have absolutely been out there hosting vaccine clinics at churches, at park districts, at senior centers. The city of Chicago also is doing them in buses. Apparently, they partnered with CTA buses, and so they've been doing very creative things as to how to get the word out. I also know they've been going into CHA senior buildings. So really, it's trying to go where people live so that it's as convenient as possible for you to get the vaccine. I'm so glad Deputy Governor Flores talked about the J&J vaccine.
Mhm.
That has also will hopefully continue to be utilized for homebound seniors. We obviously have a homebound program throughout the city of Chicago. The Chicago Department of Public Health has that up and going. So throughout the state, we also have some homebound programs that are up now and running. So we want to make sure, again, that if in fact you haven't got the vaccine yet, you're going to get it, and this is how you can do that. So many resources out there. So please, we hope to make sure that you can utilize them.
Wonderful. So I'm hoping we still have Deputy Governor Flores. Yes, here she is. We're going to black and back. So
Sorry.
no,
My telephone is not good.
This is the world of virtual. If it doesn't happen, it's not normal. So Deputy Governor, we've seen 30% of the state's 2.7 million population been vaccinated, and that's according to the IDPH site. What do you see as barriers or even hesitancy for people getting vaccinated? And then what can people do to alleviate those concerns? Talk about that.
Yeah, Lori, so we're definitely seeing hesitancy, right? And I think some of your viewers have seen there's different buckets of folks. There are folks who are like, I'm lining up, I'm going to call, I've got all my devices ready to go, I'm getting that appointment, right? And those were folks who, when they were eligible, got in line and got it. And as the state opened up more, they have, gone to mass vac sites. They have figured out a way to get it. There's a group of individuals who are, not sure at all and probably don't want to get it or want to wait several years, and lots of different reasons. And then there's a middle group of folks, and this is who we're really focused on right now, who have said, I am interested in getting the vaccine, but I still have some questions and I'm not quite sure how to get it, or, my work schedule hasn't allowed for it, hasn't been convenient. I can't go during office hours. I can't go during the middle of the day. I can't get transportation. I can't access, I have a digital barrier. I have a language issue. So those are the folks that we're really trying to get to, right? These folks who are in the middle, who are hesitant because of access, or hesitant because they need a little bit more education. And so these are the things that we know work. One, if you have received the vaccine, how can you go help find your local community, friends and family, and encourage them and let them know I got the vaccine and why you got the vaccine, why it was important to protect yourself and your community. If you are someone who has had COVID-19 or had someone in your life that's passed from COVID-19 or been very ill or sick or suffered in some way from COVID-19, sharing those stories, if you can, with others makes a difference. And we've seen from market research that those are some of the most effective stories, those individuals sharing with others about how COVID-19 has personally impacted their lives. And then, of course, what we know is also effective is individuals being able to hear from trusted clinical medical sources. So their doctors, their providers, other types of clinicians about what the vaccine is, what it means for your body, what it means for us to be able to take it, et cetera. Mm-hmm. In Illinois, Lori, right now, some of our most hesitant populations where we're seeing the least amount of uptake right now are in our communities of color, particularly in Black and African American communities. We have got to do better. We've got to get those numbers up. And so we're talking to stakeholders. We're understanding what is it, what barriers can we dismantle to making the vaccine more accessible and providing individuals with the help that they need. A second area where we're seeing hesitancy and want to improve our uptake is in rural communities around Illinois. And there may be different reasons why they're hesitant. So we know the same messages may not work exactly. What you use in urban areas for a Black population might be different than when you're talking to white folks in a rural community in central Illinois. And so again, looking for local partners, local other community members to say, I got the vaccine. This is what made a difference for me. This is why I did it. And then here's the last thing I want to say, Lori, is we're really working to tailor. We, the state of Illinois, are working to tailor how we get the vaccine to communities. So I spoke earlier a moment about barriers. We're working to dismantle those barriers. Yesterday, the governor announced our community partners vaccination program, and it's essentially vaccination in a box. Organizations such as churches, nonprofits, social services can sign up online. It's a very simple form. We ask you 5 or 6 questions to partner with us to say you will help host a vaccine clinic in your local community. And what the state brings is we bring the vaccine, we bring the vaccinators, and we transport the vaccine there. And you, community-based organization, church, parent group, whoever you are, you get the people there. You get us the arms to give the shots to. We're making those vaccine clinics flexible. They can be in after work hours. They can be on the weekends. We're also working to make registration as flexible as possible. They don't necessarily have to sign up online. We're allowing those organizations to say, hey, social services organization ABC, you know who your people are. Can you reach out and get 200 of them here on a day that you deem best? And so they schedule it with the state. I invite your listeners and those who are leaders in communities or work with organizations to go online to the Illinois Department of Public Health and sign up to help us host a community-based vaccine clinic.
That's wonderful. So I do want to, let's go to the next. We're talking about really positive energy. The state's offering it, just let's connect. But what's happening right now? There is new variants coming out. IDPH has put forth really good information about the variants. I know in nursing homes, there's multiple ones that are circulating. If you turn on the news, you turn on your phone, this information there. I would just pose it to both of you. What do we know about the variants? And then let's kind of debunk some of those things as, oh, the vaccine won't, help me with these variants, or there's a lot of misnomers that I'm afraid is the hesitancy. So real quick, let's talk about the variants, what we're seeing in Illinois, and why your thoughts and the vaccine education is so important tied to that.
Yes. So first and foremost, I want to absolutely confirm what you have said, which is all 3 vaccines available to us right now in the United States of America, in Illinois, are effective against all of the variants currently circulating. So that's very important to know. And specific to variants, we know it's the B.1.1.7 that is the most prevalent now here in Illinois. And as you said, Lori, our numbers we're going in the wrong direction. So definite increases in the number of cases and increases in hospitalizations over the last week. We have started to see that slowly level out. So there are glimmers of hope. It is very positive from that perspective, but we're not there yet. And we still have a lot of work to do. And, Paul alluded to this before. We know, a lot of folks are just, you're over it. You want to get back to normal, and fatigue is real. But, if in case you don't remember, right, or in case you haven't been personally impacted, think about all those hundreds of thousands of Americans that have died. Someone in your life could be impacted either through death or what is almost just as bad. We're hearing horrible stories of what we call long COVID and the after effects of having COVID-19, and how some of those symptoms continue to be debilitating for individuals and actually have them have lifelong disabilities. And so the importance of understanding how we're managing the variants is to still do our masking, is to still do our physical distance. The CDC has very specific guidance for if you have been vaccinated, what your personal behaviors can be with other vaccinated individuals. And at a particular time, you have to wait a full 2 weeks after your last vaccine shot, or in the case of J&J, after your initial and only shot. And those are guidelines specific to vaccinated individuals. And if you are in mixed company, then the regular guidelines that we're all aware of around masking and distancing do apply. I also, Lori, want to help remind your viewers about your grandchildren, right? And your nieces and nephews. And we still do not have a vaccine approved for those children younger than 16, right? And so I think about my own family. I live in a multi-generational household with 2 seniors and a 13-year-old and a couple of 30-year-olds. And we still do everything to protect ourselves. And in the beginning of the pandemic, it was about protecting the seniors that lived in my home. And now it's about protecting our 13-year-old and making sure that we, as the vaccinated adults in our household, don't unknowingly give it to her. And that is still possible. So I encourage your listeners, please, 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 the variants are real. They are here. They are ravaging our world. Yet we have the tools to get out of this. We have the tools to make it better. And if we can do this right now, then our future can be brighter. And when we get to that bright future, it can be continuous. We may not have to do all the pauses and back and forth if we can get to a place where most of us are vaccinated and we continue to protect ourselves.
So
and if I
yeah,
can just
please.
jump in, I think the good news too is what the governor said yesterday, which is the supply is here. We have the supply now. And so the point is you will and can get vaccinated. Unfortunately, people want to remember, oh, I heard I called and I couldn't get through. That's not the case now. We have finally even the playing field here. We have the supply. The supply and the demand are flat now. We are there to do it. So
yes, thank you, Paula.
Please encourage people.
Right. If I could make my font bigger, I would. So I would just say my daughter calls me the queen of safety because I double mask them up and everything. So we're running it into time, but you did talk about the long haulers. Let's real quick. This has made a profound change in our healthcare, the landscape for nursing homes. We know now with the data that we already knew inequity in care, understaffing. We're talking about telehealth, that the technology's there, we've shifted. So what is the long haul change that you foresee as administration that will improve the lives of those who are 50 plus, especially Illinois seniors? And we're going to go to closing.
Yeah, Paula, I'll go really fast. I'd love for you to weigh in here too. Lori, it's exactly that. We want accountability in all of our nursing homes, particularly our private homes that are receiving our Medicare and Medicaid patients. That they should have the same type of quality, accountability, staffing as a pay as you go or private pay. We also want to make sure that accountability uses an equity lens, right? We know that in Illinois, those nursing homes that fared worse and that have the lesser ratings are those that predominantly serve African American, Latino, and disabled individuals. And we need to do better. So accountability and transparency and ensuring that there are payments made on quality care, the same thing that you and I would expect for the people that we love, we want for some of our most vulnerable and poorest Illinoisans as well. Paula?
Yep, thank you. And so what I'd also like to say is we know our older Illinoisans they're the ones who have been the holders of the rich history of the state of Illinois, and we need to do a better job as how we hold them up to make sure that they have what they need in order to have the best quality of life as they grow older in Illinois. And to that end, the Illinois Department on Aging, our biggest charge is to keep people in their homes. And in that way, we have our largest program, which is our community care program, our CCP program, which brings in supports and services so it will allow you to stay in your homes for as long as possible. And that also, with an equity lens, we want to make sure people know about that program. They are able to access that program. To stay in your home is, I hear from all our older adults, one of the biggest things that they want to do as they grow older. And so we as an agency are all about having that happen. We give resources, supports, different programs, different grants to our care coordination units, our AAAs, our area agencies. We have done an amazing job. The Aging Network has done a great job. We've had to shift and pivot and doing home delivered meals instead of congregate dining sites. But folks, we're going to get there. We're going to get there, but we all need to be vaccinated. And so to that end, however we can help you do that, please, please let us know. You are not alone. And we appreciate so much of everything of what people are doing out there. The volunteers, the community partners, the churches, the park districts, all of our social workers, our care coordination, everybody who's out there, our AAAs, AARP Illinois, all of you have done and continue to do amazing work. We are all in this together. Thank you.
Thank you very much. Thank you, Director Basta, Deputy Governor Flores. We're coming on our ending of half past the hour, and we've put on there a senior helpline that connects you to the Illinois Department of Aging, and they're there to help you on these issues, talking about community care program, getting connected to your area agency on aging. The resources you need are there. But as this show is talking about the COVID-19 vaccine, I do want to put this back up. I want you to know the COVID-19 vaccine through the state of Illinois has this vaccine appointment hotline, 1-833-621-1284. It is open 7 days a week from 6 a.m. to midnight. They're there to help. Again, write this down, 1-833-621-1284. I want to thank you, our special guest, Deputy Governor, for your time. We do appreciate it, and the Director for your time. This was enlightening. You are wonderful. And for our viewers and our rewatches, we thank you. On behalf of AARP, we thank you for joining us this morning and watching us. This is critical information for you to talk with your doctor about and make the choices right with you. Connect with your local community resources, your medical professionals, and we thank you and stay healthy. Guests, thank you and have a safe day. Goodbye.
Bye-bye. Thank you.
Thank you.